Hello. Thank you so much, Susan, for coming to Prevtalks, and it's a pleasure to have you here. And I believe, our audience, when gets to know you, it will be even wonderful to understand your career, your path, your purpose. And so tell us, first of all, a little bit about yourself, how you come to work in this particular field of health and well-being at the workplace, and tell us a little bit where you come from and where you are now.
All right. Well, thank you all. It's wonderful to be here, reconnect with you. It's been a while since we were in conversation together like this. I live in the United States and work just outside what many around the world know as the Motor City, Detroit, where the origin of the automobile. And so that's where I live and work. And the short form of the story of how I got to where I am today is I started out as a school teacher, teaching science and health. And I found that while I love helping people learn, the young ones were not the ones I wanted to spend time with every day. So I went back to grad school and expanded my focus on health. And since that 25 years ago, I've been helping organizations, communities, any of all sorts, build space within and environments and cultures that enable their employees to thrive, with the expectation that the business would then thrive. If your people thrive, the business thrives. And so that's what I do every day, and in a lot of different ways, because no two organizations are the same. I do a lot of teaching of adults in the workplace, and work teaching my clients how it works. So I haven't left that, but it's no more grading papers, and it's wonderful.
And I come to know a little bit also, you are sharing with the community, not just in your you're professional, but you also have the Growth Collective podcast, which is amazing and I can only recommend. And you also talks a lot about this flourishing and really looking at health in a much more strategic way than it used to be in the past. And in your perspective, Susan, how you were able or are able through education, I imagine, and through a lot of health literacy also, how do you able to awaken the organizations to play this key role in promoting the health of their own people, and that this will of course relate to their business results and the performance of the organization as a whole? How to awaken this conscience?
I have worked with a number of organizations over the years. Now I work in a role where I work with many different organizations, but in the past I was, the number of times, the only individual employed by the organization with responsibility for helping the employees thrive. I worked for an electric and gas utility, which is a very unique place to work because you've got all types of workers. I worked in a health system. I worked in a engine plant, a car engine plant, so lots of different environments. And through that experience, what I learned is that, awakening the organization starts with really leadership understanding why having healthy, thriving workers matters to the business of the business. When I think about the utility, for instance, we were very focused on being, the engine of progress for the community. If you think about it, having electricity is really important. It enables people to work and do all sorts of amazing things. If that was our purpose as a business, to be the engine of progress, and our coworkers couldn't show up every day fully engaged, electrified, for lack of a better description, and ready to go, then we were going to have a hard time delivering on the what we needed and wanted to do as a business. And that was exactly the case I made, as I sought to understand, what does leadership care about? What's driving the business? What matters to the organization? How do we measure our success as a business as a whole? And then I worked my way backwards from there. Well, if this is what matters, then what do we need our people, from our people, for our people, to enable them to show up to deliver on the organizational promise? And I've done that over and over again. And it's hard because, you and I likely think alike. Of
Yes,
course,
yeah.
health matters, and of course, being well is the most important thing for everyone. But when you're working within a business, it really starts with thinking and caring about what the leadership of the organization cares about first, and working with what their priorities are, and then latching on to those by helping them understand the benefit of having healthy, thriving, engaged employees, and how that can help them accomplish the goals of the organization.
Do you think it was harder in the past to build
Mm.
this, case, or recently you see that there's more sensitivity, that it's more easily to align the purpose of health with their own mission as a business, as a contribution to the society? Do you think it comes easier, or what is your perception?
Uh, I think that if you're familiar with the diffusion of innovations, I think we're still on that, maybe even the early side of the adoption, even here in the States. And part of the reason I would say that is we're definitely talking about it more. My sense is it's still tactical in nature versus strategic in nature. There's still a drive to solution for it, problem solve for it, and move on, versus think about it in a holistic way, really look at the organization as a whole and consider how it impacts the well-being of individuals from a social perspective, a process, policy, procedure, really taking it all in. We still, it's not as common for organizations to do that. What is more common than it was years ago is looking for solutions. Could we find a vendor or partner organization to help us solve for this, versus changing the whole organization? And that's happening and more often than it used to, but we're seeing more of what was, early adopter years ago, which was find a partner to help us do this smarter, faster. So there's more. Yes, it's growing. Are we quite there
Not yet.
strategically? Not yet.
Not yet, but you're coming. In Europe, that's interesting because there's a lot of pressure also in terms of the sustainability report, particularly in the social
Mm.
dimension. And this could help us a little bit trigger, because we've seen also, for instance, with the psychosocial risk assessment, that only after legislation pushing organization to really implement it in a systemic and comprehensive way, only after that actually organizations started doing it. So perhaps with also this pressure to report on their social sustainable measures, and also impacts, not just to offer the solutions, oh, we have this and this and this, because many organizations are still in this, well, we already have this we have all these services, so the issue is solved, right? But in the end,
Yes.
it
Yes.
it's not the reality. So when you start working, with the organizations, what are the three things that you consider critical to really foster the flourishing of their human capital? And what three things do you start by advising, changing, proposing, advocating for? What do you try to influence to create this environment, as you were saying, to educate, or to create this environment of flourishing of their people?
Yeah, I think, here in the States, where our social systems are nowhere near as wonderful and thoughtful as they are in other countries, frankly, one of the first places we start with is really thinking about Maslow's hierarchy of needs and how that applies in the workplace, and wanting to make sure that basic needs are being met by the organization and for those individuals. If an individual is not making enough money to live, to fund a life with one job, that's going to be a challenge for the organization to enable flourishing. If they're not providing work schedules that are stable and consistent, that will impact the individual's ability to show up every day. I've talked a lot over the years about, if I'm not feeling secure in knowing that I have a job, which is something that is going to play a role probably over these next years, couple year, hopefully, only. But also that if I'm worried about being able to afford a basic life, or maybe it would be better than basic, then I'm going to have a hard time showing up every day and fully engaging and doing my best work. And so that's one of the first things we talk with organizations about, to understand what that picture looks like. From there, the other piece that's become, this is gratefully a change that we're taking full advantage of. But the other piece that's becoming important is, individuals want to know if they're going to dedicate time to working for an organization that has meaning and purpose and makes a difference. And so we're talking more and more with organizations around, why does your organization exist? What difference does it make in the world? Or what difference does it make to your own employees? And really getting clear on having impact beyond financial impact, beyond just growing a bottom line, and helping employees see the connection, the role they play in that, so that they understand that being a part of that organization has meaning and purpose, that the work they do has meaning and purpose, or even being a part of a team. If it's showing up for your coworkers, every day is what's important, but that takes work and intentionality for the organization to build that space. So that, I think, is the other one, when I think about the two. And then the last one that I would highlight, just as we map out the basics, individuals really want to know that their existence is meaningful, but also that they can grow. And we're seeing here this big growth of a younger workforce. And they have learned as they were growing up that, they have so many possibilities. And if they, just, really stick to it and try and give effort, that the world is their oyster. And so that's the reality of the workplace. And it's very true. But the workplace we have now is that if organizations aren't giving their team members opportunities to learn and grow and feel like they're making a difference, not just know what the work does, the impact of work is, but actually feel like they're challenged to learn and grow each day, then they're going to have a hard time retaining and engaging that talent. And so that's one of the other pieces that we work with organizations on, which is a little bit more complicated, but what steps do they take to create career paths for individuals, to give them opportunities to grow their skills, to connect with their coworkers, whatever that looks like, so that they can really feel like they're growing. I mean, flourishing, the science teacher in me is always reverts back to this idea that, what would you do to help a plant grow? If you were, you brought a plant home and you were going to grow it, you were going to want to give it water and give it sunlight and give it some attention. And we need to, water and give sunlight and attention to our team members too, in unique ways. And that's the other challenge, because what worked for one doesn't work for everyone.
Consistently, right? Also consistently. So it means that it's not something that you do once a year, that you have to be watchful and consistent about this effort to really create these learning opportunities, and that that people actually feel that they matter, and that they are watched and supported and guided in their own learning journey. Great. And you talk a little bit about the context of the United States, particularly in terms of employment, in terms of also the strategic component that health can actually learning, still in the learning curve. But what do you find about the landscape of the health promotion in the workplace currently in the United States? How do you see it now and also evolving? Because the United States has a lot of, I'd say, providers, different kind innovative interventions, tech-based, not tech-based. So how do you see the landscape currently in health promotion at the workplace from the United States, and how do you see it evolving?
Yeah, it's amazing. I mean, just in the last 5 years, I mean, when I started working, almost 7 years ago with the organization I'm with, we were so heavily focused on physical health partners for business. Organizations wanted to do health screening or, blood pressure checks. It was, walking challenges. It was just physical activity related. In the last 5 years, the focus has expanded significantly. Tremendous focus on other aspects of physical health, musculoskeletal health. We have a lot of physical therapy, pain management focus that is growing. Part of it, I think, got some traction because so many folks were home during the pandemic, sitting in workspaces that weren't ergonomically correct, and but other reasons, they're realizing that, having folks who aren't physically well in other ways really impacts their ability to show up and be focused every day. But we're also seeing growth in two other areas. One is mental health. It used to be here in the States, organizations had an employee assistance program, which was access to free counseling for a number of sessions. And now we're seeing that a tremendous growth in just those programs in general, because there were some organizations that didn't even offer that. So giving them access to free counseling, and then adding on access to some of the platforms where they can do digital coaching and connection with some health and counselors virtually, so that they can reach that at other times a day. And then the last one is continues. It was important, growing in importance over the last 5 years, but especially recently, is financial well-being. We're seeing more open talk about the reality that, I don't know what it's like there, but here years ago, they stopped teaching in K-12. They don't teach children how to budget, how to run a household, how to manage finances.
Well, in Portugal, they never teach.
Oh, yeah.
At
They
least
used to teach it.
30 years, I'm sure they haven't teach in education any kind of financial competence.
Yeah.
Mm-hmm.
Yeah, it's not, I mean, it's fascinating. It really is fascinating because it's such an important skill to thriving, is managing your finances well. And if you don't, if you don't learn how to do it, it can be a mess. And so we're seeing a growth of organizations that are helping individuals learn how to do that, facilitating, savings and budgeting with systems and platforms. And so those are, those are probably the most popular and common ways we're seeing evolution. Beyond, and which is a little bit fascinating, a little bit of a swing back to something that had fallen out of favor years ago, which was a focus on chronic health condition management. We're seeing that grow, and part of it is, our hypothesis is that the individuals avoided care over the last couple of years because so much of care was dedicated to COVID, so that they weren't caring for their chronic conditions, diabetes and heart disease, and so now they're not doing well. And so we're seeing a huge growth in those conditions and desire for organizations to help individuals better manage their chronic conditions.
A little bit like disease management programs and in place, also return to work, I imagine, for situations that individual has to lead the work. Yeah, but it is also a sign that perhaps prevalence is growing in specific issues, like you were saying, musculoskeletal, chronic diseases, and also mental health. Of course, this is it's all over the world, right? Now it's a buzzword, right? It used to be like something that you don't talk about within the corporate environment, but now it's completely open to talk about. It's good to talk about, as you were saying. Sometimes there's still, a path to build in better preventive approaches, right? And to really enable this thriving environment that actually avoids problems, avoids issues, avoids mental or physical diseases and impacts on health. How optimistic are you, or do you feel right now about this ability of the organization to really change? Because this is also connected to changing the way organizations are designed and process and work is designed. How confident are you and optimistic that they will be, working towards this, and also to really enable environments that really, really create a thriving context for all individuals? How optimistic are you?
I am optimistic. The number one thing I would say is encourage everyone to be patient and persistent. I was thinking about this question, knowing that you were going to ask, and years ago when I worked with the utility, I felt a lot of times like, wow, am I making a difference? Are we making progress? Is this organization, really committed, to creating space for well-being, and enabling that among their employees? And I stayed with it. I used a systems approach. I focused on what mattered to the organization, but also really was very strategic and thoughtful in how I looked at it. We were focused on the individual level and helping individuals build skills and enable their ability to make healthy choices. We focused at the social level of creating social norms, and this is the way we do this around here, and building systems that have facilitated social support for well-being. And then we also, at the same time, we chipped away and we looked at the structural elements that enabled well-being, our benefits programs, our policies, our procedures. So we looked at it at 3 levels, and we stayed committed. We didn't put it all on the individual. We didn't put it all on the organization. It was a tiered approach, working at it always, incrementally over time. And so let's see, I should have grabbed this before we joined, but I started there in 2004. So 2004. So now here we are in 2022, which is kind of amazing. But that was me in 2004, just planting that seed and growing the conversations over time, and getting more and more leadership support and attention over time as I just continued to be committed and pull in advocates and allies across the organization. And recently, the Centers for Disease Control here in the States released a mental health framework that was new. Our Surgeon General and the CDC came together to do that. And it's a framework for how to address mental health in the United States for workplaces. And in that guide, there are a few examples of organizations that are doing things well. And the organization that I started working with in 2004 was used as a best practice. So be patient, and be persistent. I mean, hopefully it won't. I think, we're moving at a faster pace now than we were back in 2004. So I would expect it's going to take 18 years or what, that maybe 16 years. I'm not doing great math here, but it's not going to take as long for everybody, but it's going to take a while. But don't give up hope and keep trying.
Yes, and you were saying that you work with several organizations. When you work with several organizations, you can see that they are not at the same stage in this process. And of course, for some it will be much faster, but for others it will take a long time. Yes. Also, it's good to have professionals that are committed to this approach, and also using a systemic approach to creating, and not blaming only the individual or blaming only the organization, because it's never a discourse that really works, right? When you blame someone, it's never a way to empower them and to make them flourish in a way, and to deliver the value that the organization needs and the people they work need. Okay, Susan, we end each conversation with a more personal question. And it's not in the script, it's kind of a surprise, but so you, Susan, what do you see yourself doing in 2030? Or what kind of work, what kind of setting, what do you wish for, and do you imagine doing in 2030?
Wow, 2030. This is my birthday month, so that is 8 years from now. Well, I'll still be working because I really enjoy the work that I do. My hope is that my ability to support individuals in organizations and help organizations build extraordinary workplaces has been replicated, that more organizations are following the lead of the organizations that I help over these next 8 years, 7-8 years, that they're seeing the examples and they could say we can do that. And that I am continuing to serve as a coach to executives and leaders to help them not just build strong organizations for others, but also, really build a strong self, care for self, and be walking the talk, so that they can be an example and be present and strong for themselves and for others too. So more of the same, but that others are also learning from the examples I set over these next few years with the organizations.
It could be replicated, right? It could be scaled, and that the approaches gets further and further validated. Thank you so much, Susan. Have a great rest of your day. And I hope to see you soon, whether in the United States or, why not, Lisbon.
That would be amazing.
So thank you very much, and thank you for your sharing your experience, your knowledge, and also your patience, because you are a patient, right? Working in prevention, working in creating thriving workplaces is about patience and really be resilient on the long run. So thank you so much, and have a great day.
Thank you.